Doctors and scientists are calling COVID-19 a game changer. This pandemic has not only pushed our healthcare system to its limits, it has created new challenges and driven innovation that will change the way we deal with illness and disease.
CBS 12's Danielle Waugh explains how in tonight's look at the new us.
Going to the doctor can be as easy as opening up an app on your computer or your phone. The patient on one side of the screen, the doctor on the other. Virtual house calls have become common during this pandemic, and people seem to like it.
If you're sick, you don't want to schlep out of your house to go to a doctor's office.
Sarah Green has been connecting with her dermatologist, physical therapist, and more without ever leaving home.
I think a much more efficient use of time.
With obvious benefits in protecting high-risk patients from exposure to the virus, federal regulators quickly relaxed privacy rules and payment barriers that made it difficult for doctors to offer these online visits.
If there's a silver lining to this awful, tragic thing that's happening to everybody, it's telehealth.
Dr. Terry Adiram is a dean at Florida Atlantic University's College of Medicine.
It's so important to our physicians that they're able to lay eyes on their patients.
While doctors can't perform tests or administer medicine during a virtual visit, Dr. Adiram says they are absolutely worthwhile.
But you can tell whether or not they're struggling to breathe. You can look at their color. So there's a lot of things that you can do and impressions that you can get during the visit.
And it's an important option when patients are afraid to go out in public.
Some of our chronically ill patients that we manage their diabetes, high blood pressure, they refuse to come in.
Yolette Bonnet runs the FoundCare community health clinics in Palm Beach County and was the first to set up drive-through COVID-19 testing in the state. While those efforts continue, canceled appointments at their clinics have cut business in half. Telehealth is keeping them going.
This is brand new to all of us.
Hospitals are struggling too, with elective surgeries postponed for so long. Some, like Jupiter Medical Center, are announcing furloughs. The American Hospital Association estimates hospitals will lose more than $200 billion in revenue from March until June due to the pandemic.
We just can't let our healthcare institutions fail.
Dr. Adiram says COVID-19 has been a wake-up call, exposing how unprepared government and healthcare systems are for a catastrophe and highlighting the need for greater hospital capacity and stockpiles of protective equipment.
Windows up, okay?
But on the bright side, she is seeing innovation and collaboration like never before.
I think, too, it's really going to have to drive improvements in testing, in vaccine development, in therapeutic development.
When an effective vaccine for COVID-19 will come remains a question. But one thing medical experts do know is that healthcare will be forever transformed.
I really see this pandemic changing a lot about how we not only deliver health care, but I think there's going to be a reckoning too after this.
Danielle Waugh, CBS 12 News.